Okay, let's talk about Chapter 2, Body Structures. This short little intro is on page, I don't know what page that's on. The cell is discussed, then it goes into talking about organs, tissues, etc. The chapter does a great, or the textbook does a great job at reviewing this basic cellular level of information. You can just review that. This should not be the first time you've seen this information, whether it was in high school or other college classes, just the basics of tissues and how it all works together. Da-da-da-da. If you have any questions about this, I can certainly answer those questions. I just don't want to take up your time reviewing this, or I'm not going to read it to you, obviously, but just let me know. I think the chapter does a great job in the textbook too, whether it's introducing you to this, reviewing this, and just discussing it in general. Organs and organ systems is listed. What page? Hang on, let me see what page I really am on. 46, I think. 45, 46. Um, So this chapter is an overview of the body systems. We're going to get into, or the body structures, should say. We're going to get into the systems in the coming chapters. But just make sure you understand the difference between the skin system, skeletal, muscle, nervous, endocrine, cardiovascular, lymphatics, all listed there for you. Here's a great brief review of our digestive anatomy listed there. And then, of course, terminology. Each one of these terminology boxes or tables is full of information. You're welcome to create your own little flashcards if you'd like, whether they're on paper flashcards or using an app or a website to create flashcards. I may not necessarily quiz or test you on this exact information for each chapter, but this is great terminology to know and to review. Word parts, here we're talking about word parts again. The root is mentioned in this table, and then the definition and the meaning is shared, and then an example of how it is used. For example, morph is the meaning of that word is to form. So polymorphous means having many forms. An example of this would be cancers. Cancers are polymorphous. They develop and happen in many forms. This is a picture, a figure of chromosome. You can dive into that. I will not test you on very specific things like um, chromosomes in this course. There's an exercise listed there. Another table, roots for cellular activity. You're certainly more than welcome to review that. Another exercise. By the way, all the exercises and tests are little pre-tests, pre-quizzes, what have you, in the chapters. They're all listed in the appendices or appendixes. Appendix 11 for this particular one is in the book. This textbook is full of information. Another table, suffixes and roots for body chemistry. Again, this is not a chemistry class. I'm not going to test you on those exacts related to chemistry. However, there may be a question that's a higher level question that might dig into a little bit of chemistry, and you would just want to know where in your textbook, to go look that up. So that's the value of reviewing these chapters, reading them, skimming them, whatever you choose to do, whatever format you choose. Again, another terminology list full of very strong words, good information to know and to learn. The body as a whole, this is a great review. Important directional terms are used often in healthcare, medicine, and in medical terminology. So the photos or the figures, I should say, in the textbook do a great job. Superior is high, inferior is low, anterior is front, posterior or dorsal is back. So anterior and ventral are known as the front of the body. Posterior and dorsal are known as the back side. Proximal and distal are common words you'll see. Proximal is higher or closer to the body compared to distal. So our hands are distally located away from our body, where the shoulder is proximal. And then medial and lateral is shared there. For your reference, anatomic directions. There you go. So there's your box or your list sitting right there. Frontal, sagittal, and transverse. These are not, they're good to know. They're not common used terms. We really go left, right, front, back, sagittal plane view, transverse view. Some of those things come into play with MRIs, CAT scans, or even autopsies, but not in our everyday. Ventral cavity, dorsal cavity. Again, this is front and back. Body cavities. This is important to know, especially abdominal regions in medical terminology, whether you're doing the one operating, whether you're doing the one taking radiographs, whether you're encoding, billing, uh, nursing knowledge, dentistry knowledge, maybe not the abdomen, but you get what I'm saying. You really do want to know on the body the difference between the left, the right, the umbilical, the epigastric, hypogastric, iliac, left and right. By the way, iliac is referring to our iliac bones in our pelvis. That is a landmark, if you will, of how to label the abdominal regions and what's included in those quadrants. So listed here in this figure, left upper, right lower, left lower. Different organs are located in those quadrants. It's good to know what organs are in there. Just another great figure with different terminology here: oral, mammary, axillary, um, carpal tunnel, that's a wrist, femoral, patellar, phalangeal. Review those. Again, you don't have to memorize them exactly. This is not an anatomy course. This is a terminology course. Flipping through or scrolling down because this is a external, a downloadable resource that I found. Box 2.5 is just body positions. I just review this. Supine is one that we use often because that's when obviously most of the time a patient's lying face up. They're supine. Or Trendelenburg is a position where we, for some reason, if a patient passes out or if their blood pressure's dropping, we Trendelenburg them, and that means we put their head below their body. We drop them really quick in emergency situations to get those vital signs back where we want them. And the third one I'll mention is prone. So prone is the opposite of supine. Prone, supine, and Trendelenburg are the ones that I want you to leave this course understanding what that means in medical documentation. If you are reviewing records, you know what that means. Here's another terminology. But okay, so this is just heavy terminology, and that's what this course is, correct? Review this, say these out loud as you read this in the chapter: abdominopelvic cavity, anatomic, cranial, diaphragm, frontal, pelvic, peritoneum, sagittal, spinal, thoracic. Just that simple. You just saying them out loud will help. They'll benefit you. If there's ever one you can't pronounce or you don't know how to pronounce, you can just type it into Google or any search box, search engine that you choose. How do you pronounce um, megacephaly or cervicofacial, thoracotomy, intra-abdominal? It will actually say it out loud for you. So much technology compared to when I was in nursing school. So take advantage of it. Laparoscope, ciliocentesis, peritoneal, and then your definitions are listed there of those examples. Exercise 2.4. Again, if you want to do these, your answers are in the back of the book for you, so that is great. Roots for the extremities, you can read that. More prefixes. This is a regarding position and direction. Another exercise and more terminology. Abbreviations, you will see this on your case study for this week. Very important to know. We're getting into some abbreviation usage. So the LLQ is left lower quadrant, and you can read the rest. They're self-explanatory. Anytime you see an abbreviation and you don't know what it means, what should you do? I'm going to say you should look it up. And especially if you're working for somewhere, there's going to be a published, approved abbreviation and even acronym list somewhere, and you can look that up. Don't ever in healthcare especially, it's okay to not know, but definitely go look it up and figure it out. And then if it's something that you see often, you're going to learn it and you'll retain it in your memory. But if you ever come across an abbreviation that you don't use commonly or that you don't know, just stop and look it up. And that is the end of that chapter because now we're into the labeling exercise. Please let me know if you have any questions about chapter two, and I'll be happy to answer those. And give me any feedback. I am welcome to feedback regarding the course, the variety of assignments that I'm providing. Hope you all have a good week.